The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you got to get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
Thanks for joining us, folks. This is the Predictive Health Clinic. I appreciate my new guest, Kerry Gelb, because he brings a perspective to the realm of alternative health that I think is both very old and very new. Dr. Kerry Gelb, thanks for joining us. Give us a quick introduction to who you are, and then we're going to drill down into why you're here.
Yeah, thanks, Jack. It's great to be with you. My name is Dr. Kerry Gelb, as you said. I'm an optometrist. I spend most of my time in New Jersey. I'm also the president of All Docs, which is the Association of Lens Crafters, Leaseholding Doctors. I have my own podcast, which is called Dr. Kerry Gelb, Open Your Eyes. I have a documentary called Open Your Eyes that you could see on all platforms, on Apple TV, Amazon Prime, on Google Movies and Shows, 82-minute podcast about the relationship between the eye, systemic disease, and nutrition and health. And there's something in there for everybody. There's animation, so the kids could watch it and get the message. But for the adults, we get very good reviews on the documentary, and we get great reviews on the podcasts. And I also have a radio show. I'm the health guy on AM 1280, The Patriot in Minneapolis, on Saturday mornings at 6 a.m. where I have a health show. So I'm the health guy where I have a health show. That's a little bit about me.
I just flew into Minneapolis a couple of months ago. I've got a new client up there in North Minnesota. I think that's my first time there ever. So that's cool.
I have to say, I've never been to Minneapolis. I do it from Florida.
We were there before it got cold. I don't want to be there now. When I first saw on Dr. Ovadia's show that we were going to have an optometrist as a guest, I trust Phil implicitly. He's proven to me that he knows what he's doing. But I thought, why in the world have we got an optometrist on a show about metabolic health? That just doesn't make any sense to me. And then your message was like, I don't want to be cliche. It was surprising in the best possible way. With that as a background, let me ask you question number one. What particular health issue is it that you want to address today? We want to talk about on this show things that will allow folks to either predict and prevent health problems or recover from an existing health problem. Why do I have an optometrist on this show?
Macular degeneration is the leading cause of blindness over the age of 55, and diabetes is the leading cause of blindness under the age of 55, and they're both very nutrition related and health and lifestyle related. So today we'll probably talk about macular degeneration. And there's about 20 million people out there that have macular degeneration. And when they hear that they have macular degeneration, they get very nervous because obviously nobody wants to go blind. And America's greatest fear is not cancer, but it's blindness. And people don't want to go blind. And there's things that people could do to decrease their risk of progression of macular degeneration to prevent them from getting advanced macular degeneration called wet or geographic atrophy, is the advanced dry kind, where they'll lose their central vision. And people do not want that.
Okay, let's first of all get a everyday man's definition of what macular degeneration is.
So in the back of the eye, there's all these blood vessels, and in the center of the eye is something called the macula. And that's what absorbs the light and brings the image back to the brain so people could see. So if that part is damaged, you can't bring the image back to the brain to have vision. And some people, as they get older, especially people with a lot of risk factors for macular degeneration, the major risk factors are a big belly, smoking. We don't think much about smoking anymore, but still about 10% of the population still smokes. Alcohol, and there's about 13% of the population that have alcohol abuse. A high glycemic diet. people that eat a lot of sugar, high glycemic diets, doubles the risk of getting macular degeneration.
Real quickly, define high glycemic.
Things that sugar, processed sugar. So anything processed grains or processed sugar, anything that has a lot of sugar in it,
Is that
refined
what we would normally call just high carb diet?
high carbs, or even like eating cookies and candy and a lot of desserts is what we're talking about, cakes. And then of course carbohydrates, because of glycemic, it's going to change into sugar into your body and raise your insulin and raise your blood sugar. And when you raise your insulin, which happens before you raise your blood sugar, that causes inflammation. And inflammation is the core component of chronic disease, including macular degeneration. So we want to keep inflammation as low as possible and keep those risk factors as low as we can to when we're eating, and we want to eat a lot of fruits and vegetables. I know on your podcast, it's a lot about carnivore. And I remember when I was on the podcast, there were some comments because I'm not pure carnivore. And, you have to be reasonable in my situation where I'm seeing patients, to tell people just to eat meat all the time is not going to fly. But we know that kale, spinach, collard greens, things that contain carotenoids, lutein, and zeaxanthin will decrease the risk of not only macular degeneration, but also cataracts as well. And there are supplements out there that have lutein, zeaxanthin, and mesozeaxanthin that kind of give it a boost. So we could raise the pigment in the back of the macula. The macula has this coating, this pigment coating, almost like a tan, that will absorb all the light that's coming in, prevent scatter, help you see better. Actually, if that pigment goes thick, it'll actually help athletes play better. Baseball players will play better. Will be able to hit the ball better. Tennis players, because it increases temporal processing speed. It also helps us from when we're outside of being very sensitive to light. A lot of people are very sensitive to light. That's called photophobia. But that lutein, zeaxanthin, mesozeaxanthin, those carotenoids will help people with the sensitivity to light. Or if you have sensitivity when you're watching a movie and you go outside and you're dazzled, that is because you don't have enough pigment in the back of the eye. But when it comes to macular degeneration, there are certain things that we know for sure which will decrease the progression. One is to have a good diet. Exercise could decrease macular degeneration by about 40%. So we
Okay,
want
I want to quantify some things. You talked about high glycemic. Quantify turns, quantify what high glycemic looks like as opposed to just,
So if we eat simple carbohydrates, so if we're eating white flour and we're eating sugar, what happens is it raises insulin in the body, and the blood sugar goes up and then raises the insulin. So
right.
there are two bad things happening. High insulin, if it stays high for a long time, could cause insulin resistance and could cause just as much damage to the body as high blood sugar and damage to the capillaries in the eye. So we're looking at the capillaries in the eye. We're looking for damage of those capillaries. So if those capillaries start getting damaged from either diabetes or when someone has macular degeneration, the cells in the back of the eye, there's a lot of inflammation that's knocking off those cells and damaging those cells from the high glycemic diet. Same with the big belly. The big belly causes inflammation. It's like an endocrine gland, just oozing inflammatory cells. So if you have a big metabolic belly, you're releasing all these inflammatory mediators that damage not only the eye, but different parts of the body, the brain, the heart, all different parts of the body, increase the risk of Alzheimer's, etc.
So the early warning is a big belly. Pay attention to what's going in your mouth. Is there what's it called, a fasting glucose test that you could take that would give you a little bit of early warning on
Yeah,
that?
I mean, that's a great question. I actually did a study. When we look in the eye, we can see the capillaries at about 8 microns, which is very small. And so if we're having trouble with the eye vessels, then you're going to have trouble with the vessels in the heart, the kidney, the rest of the body, the brain. But we could see the eye vessels, and we would see these little swollen spots inside the capillaries when we got this new imaging instrument that was able to look at the capillaries at around 8 microns. So then we started doing blood tests, And we saw that the fasting insulin was high, the 2-hour insulin was high, and also blood sugar was high. So not only do we test just blood sugar, because you can have normal blood sugar because your insulin could be high for 20 years before before it affects your blood sugar, and the cells in the pancreas crap out, and then all of a sudden it's a rubber band effect, and then the blood sugar goes way up. So you always want to know about the insulin levels.
So, if I understand you correctly, an optometrist who knows what he's looking for could actually see early signs of this in the eye?
Sure, so when we're talking about macular degeneration, the earliest signs we see is something called drusen. These little deposits in the back of the eye that are made up of protein and fats. It means the center of the eye is starting to break down. And there are certain things that we could recommend to decrease that from getting worse. And depending on the studies, if we do a good job of getting those nutrients into the serum, we could decrease the risk of progression up to 93% of macular degeneration. But most of the time, it's somewhere between 40 and 93 because not everybody is a good absorber.
Okay, I want to try to get back to my script here, which is what's the most common misconception about macular degeneration?
The biggest misconception is the retina, the back of the eye where the macular degeneration happens, doesn't feel any pain. So they think you could see good, but they don't know that there's something going on because then they don't feel any pain. So that's why it's so important for people to get their eyes examined and get imaged, retinal imaging, because the images could see the technology with the imaging, the cameras could see better than the doctors can. So we could take a picture and then the doctor looks at it and we could see how advanced or if somebody has disease, rather than when we used to look in just with an ophthalmoscope and we could see about 150 microns. Now the cameras could see down to 8 microns.
As an early indicator, you need to see an optometrist, but it's more than just an optometrist. It's somebody who, what are we looking for when we're trying to?
We want most optometrists now are very well trained and they have retinal cameras. So we want to make sure they have a retinal camera and they get imaged. So we could look at the back of the eye, the retina part of the eye, the capillaries, and the macula to see if there's any changes.
Should I say to my prospective optometrist, do you have the ocular camera that can see down to 8 microns? And do you know the signs of the early warnings of macular degeneration? A good question, an offensive question? What?
It's a good question, but it's like going, not me, but it's like going to the barber and saying, do I have hair? I mean, this is something that's very routine that all optometrists, 99% of optometrists will do.
All right, good. That's really what I was trying to get at. Is this something that's what they do?
Yeah, this is what we do. Yes.
All right. Very good. Let's assume the next question is actually it's 2 questions. One, what can people expect if they don't take action? What's the predictable likely outcome? And what do we do to recover from or prevent macular degeneration over the age of 50?
So depending on which stage of macular degeneration, if you don't do anything, there's a certain percentage of people that will go on to lose their vision in one eye or both eyes if they don't do anything. They don't change the way they eat. They don't take some supplements. So let's talk about what you could do to decrease your risk of macular degeneration. You want to eat real food like your great grandmother used to eat. Everything with one ingredient. Now, not everybody's going to be perfect, but you want to do the best that you can. You want to stay away from processed foods. You want to eat a lot of green leafy vegetables because they have lutein and zeaxanthin in the green leafy vegetables. So we know that lutein and zeaxanthin, which are carotenoids, which are plant pigments. So the spinach is colored green, and these pigments protect the spinach, but it also coats the back of the eye, the macula, to increase the pigment. So we want to eat foods with lutein and zeaxanthin, which is kale, spinach, collard green, orange, yellow peppers, eggs. So those are things that for eggs, the yolk, not the white part, the yolk.
Eggs are not a green leafy vegetable.
No, so we want to.
You've made my day.
So eggs are good.
Vegetables.
The yellow part of the egg. There's a lot of lutein in zeas, and it's very bioavailable. So it'll get into the body, into the serum, into the blood of the body. So it'll take it to the part of the body that we want it to go to. Omega-3 fatty acids. So wild salmon, sardines, mackerel, or we want to take omega-3 supplements, good ones, triglyceride form, omega-3 supplements, because we know omega-3s will decrease the risk of macular degeneration. Everything's around 40%. We know and we talked about eggs, there's been study on eggs. And if people that eat eggs 5 or 6 times a week decrease their risk of macular degeneration about 60% compared to people that don't eat eggs. So same with oranges, decrease the risk. So vitamin D3. You never want to take vitamin D3 without vitamin K2. But D3, K2, we know that vitamin D will decrease the risk of macular degeneration. Vitamin D is an immune modulator. So we want to make sure that we are taking vitamin D, or there are certain people who think taking vitamin D isn't a good idea. And of course, it's better to get it from the sun. But if you can't get it from the sun, you want to take D3K2. We know that will decrease the risk. There's plenty of studies on that. New studies that have come out, curcumin, which is, is part of turmeric. 6% of turmeric is, so if you're taking turmeric, it's not enough. It has to be the curcumin part, which is very anti-inflammatory. We know that macular degeneration is an inflammatory disease, so curcumin is good. A new study also, a second study on melatonin. Melatonin decreases the risk of macular degeneration. The B vitamins. So you mentioned blood tests before. There's a blood test called homocysteine, which is a biomarker for inflammation in the body. If homocysteine is high, there's a greater risk, as you know, you work with Dr. Ovadia, that there's a greater risk of cardiovascular disease, stroke, Alzheimer's, but also a greater risk of macular degeneration. So the B vitamins, B6, B12, B9, you want to take a B complex or a multivitamin that has good B vitamins. These are things that we know will definitely decrease the progression of macular degeneration. And number one thing that you'll learn from you, I think you interviewed Dr. Kenobi, oils, vegetable oils. He's done extensive research on vegetable oils, seed oils, how these were not available before about 1880, and there wasn't chronic disease. And once they started with the vegetable oils and they stopped using tallow to cook with, then chronic disease started along with all the other processed foods. So we know that we want to stay away from any type of oil. So anytime you're in Costco or somewhere and you want to buy protein bars or energy bars, the first thing you do is turn it around. Is there added sugar? Is there seed oils in there, which is canola oil, peanut oil, palm oil, any of the processed oils you want to try to stay away from?
It's interesting. I have a suspicion that anybody who's paid attention to the world of metabolic health over the last several years knows that seed oils are bad. Unequivocally bad. There's no good reason to have seed oils in your diet. And yet, still might not have the emotional motivation to make the change. But knowing that it could lead to blindness, I suspect that will trigger strong enough emotions that people would be willing to make a change. It's funny that getting fat, I think, it's not as, maybe it's just because so many people are fat. I don't know. But knowing that your continued use of vegetable oils could very well lead directly to the loss of your eyesight, and stopping it could prevent it, I think that would be pretty motivating. All right.
And like I said at the beginning, blindness, Americans' greatest fear.
Yeah. I did not know that, but it makes sense. All right, I'd like to ask a couple more personal questions at this point. What's one of the most gratifying compliments and maybe some of the more common complaints that you get when you give this information to people?
Well, most people want to know how they can make themselves healthier. There's a misconception in the medical community that patients only want medication and that's it. But when I bring up about health and nutrition, everybody's ear perks up. They just don't understand it. And if you look at the amount of people that take supplements, 50% of Americans take supplements. And over the age of 65, 68% of Americans take supplements. And the supplement industry is a $30 billion, over a $30 billion industry. I've seen 30 billion, I've seen 60 billion in numbers, but not that many people would take supplements if they weren't interested in being healthy.
Yeah.
So people are very interested in being healthy. And as far as the complaints that we would get, the only complaints that we get sometimes is, things have been, inflation has been very bad over the last number of years, as you know. And unfortunately, a lot of people can't afford the supplements. They can't even afford their medicine. I have patients say to me, Doc, I could either afford food or those eye drops you're giving me for glaucoma. I can't take them every day because I can't afford them. And, we try our best to get samples for people, call the pharmaceutical companies to get free medication for people that come out with those type of comments. But that's heartbreaking. And that really breaks my heart when people say that.
Yeah, I can imagine. All right, this is my favorite part of the show. 8 words. If you could deliver your health message and you had no more than 8 words to deliver it, what would that message be?
My message would be to eat real food. Stay away from processed foods. Eat like your great grandmother used to eat, and eat the rainbow.
That's more than 8, right?
How many was that?
Eat like your grandmother used to eat, though. That's a pretty good one. That's pretty good. And dump the seed oils. Yeah. All right, Dr. Kerry Gelb, thanks for joining us. Contact information for Dr. Kerry Gelb will be available in the show notes, but I would like you to give it to us one more time anyway.
So you could find me at drkerrygelb.com. You could also find me at wellness1280.com. Open Your Eyes podcast, which is released every Monday morning. And my radio show is Open Your Eyes, AM 1280, The Patriot, Dr. Kerry Gelb, Saturday morning at 6 a.m. in Minneapolis. And our movie, Open Your Eyes, on all places where you can watch movies and stream them.
Very good. Thanks for joining us, Kerry. This has been the Predictive Health Clinic. I appreciate you being with us. We'll talk to you all next time.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.